Hi, I am Dr. M.R. Pujari. I am dental surgeon as well as implant specialist at iSmile group of dental clinics, Bengaluru, Karnataka. So many patients have a complaint about their big size tooth or a protruding teeth, especially if the teeth are front. They will not be very confident in smiling. So often they are a little concerned about the treatment modalities for such teeth. So there are different treatment modalities in dentistry based upon their teeth condition. And it can cost based upon that. It actually starts from 8,000 to the basic we call veneer or a crown, and it can go up to 30, 40,000, 60, 90 and even up to 1 lakh based upon the case. So it is always recommended to visit dentist for a better opinion. So protruding teeth or the big teeth, there are different modalities. Coming on to the first one, most common and a fastest aesthetic way of making the teeth better. That is, one is veneer we call, where we cover the tooth with the desired shape of the tooth. Then we have a crown, a full jacket crown we call, and then we have braces. There are different types of braces, starts from your metallic braces, ceramic braces. There is self-ligating braces, lingual braces, putting braces on the back side of the teeth, and then you have invisible or clear braces. These are different ways of setting your teeth properly. So cosmetic treat, basically smile correction. If you are looking for a quick, you don't have time for the braces. Braces normally take a year time, and if you are looking something a quick remedy for that, then we have something called veneer. We have laminates, and then we have crowns. Basically, they can resize your desired tooth size to the desired size, and they can also make your teeth look different shades. Like if you want a whiter shade, we can actually do that. So this comes under cosmetic dentistry, where the shape of as well as the color of the tooth can be modified as per the requirement as well as per the need of the patient. So cosmetic dental treatments, as we discussed, the crowns, the veneers, laminates, they need little tooth alteration. These are the shortcut way of getting your smile better, but yes, they alter the enamel. When compared to the natural way of braces, there is little alteration with your teeth, and it can result in little sensitivity. To manage that, normally we give local anesthesia. The anesthesia part you might feel little pain, but the entire procedure is painless. So we do under anesthesia, local anesthesia, we modify the tooth size, and then we take the impressions, followed by we put the crowns, which normally takes 3 to 4 days to finish the entire cosmetic treatment for your teeth, basically veneers, laminates as well as dental crowns. In cosmetic dental treatments, as we discussed that the veneer, laminate, then the crowns are the best ways of correcting the smile. So normally these are used with the best quality. So we have ceramic layering techniques, and we have zirconia crowns. They give a better smile and a better shade of the tooth. Ceramic veneerings, normally they start from the 8,000 rupees. It can go up to 12,000 based upon different brands. Laminates also in the same range. They can start from the 10,000. It can go up to 15,000 per tooth. In case of laminates, basically these are ceramic laminates. And then we have zirconia crowns. They also come in different brands. Zirconia crowns normally start from 10,000 rupees. They can go up to 15, 20,000 based upon the different brands. That is per tooth, and they have their own life. Normally they come with a 10-year warranty, 15-year warranty, and there are some 25-year warranty as well. The warranty is basically based upon the strength of the crowns, and different brands have their different warranty as well.